Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome Mr. Nima Ahmadi, the co-founder and CEO of the Wound Company, as well as registered nurse Julie Roskamp, the head of the delivery care team. Welcome.
Thanks for having us.
Our pleasure, our pleasure. So I want to kind of start off with, you both are here with the Wound Company, and, when Nima and I had spoken previously, I shared, my situation with my father, had a really significant abscess that the wound degraded, the abscess burst, and it led into a lot of intensive wound care. It's not something that most people are walking around really giving a lot of thought to until the situation happens. But it got me thinking too, and I'm wondering how many patients are impacted by wounds and or ostomies in the United States, would you say?
By the most conservative estimates, Lance, there are 13.5 million people per year suffering from a wound and ostomy. The published literature shows that over 15% of Medicare beneficiaries have a wound every year, and those numbers are growing because our population is aging and folks are getting sicker every year with rising levels of metabolic disease.
Would you say the demographics then are usually like our Medicare-aged loved ones?
That's right.
Yeah.
The majority of folks who have a wound are over 65. So about 10.5 million of that 13.5 million figure. And for ostomy specifically, we know that there are about 1 million people in the United States battling some kind of ostomy and finding a way to live and move forward with an ostomy, and 100,000 new ostomies per year. That's the best data available.
And that's a lot of people, right? What are, and maybe this is a question for Julie or for you, Nima, what do you contribute those numbers to? Is it the skin elasticity breaks down, our diets get poorer, our bodies aren't able to, keep up with it? Like, what's the connection between our 65 and over population and these wounds?
There's a lot of contributing factors. Weight, mobility, and generally some of the lower extremity wounds can be because of, metabolic conditions like diabetes. Our aging population, their skin is less resilient and they're less mobile, maybe spending, long hours of time sitting in a chair, laying in a bed. They can get pressure injuries from that. Circulatory issues where they're just like when they have a stroke in their brain or a heart attack, they may have poor circulation going down to their lower extremity, which they can develop wounds just because they don't have blood flow getting to that area over time. So, yeah.
What are the most common types of wounds?
I would say there's a lot of venous leg ulcers, lower extremity wounds, diabetic foot ulcers, and then probably pressure injuries from there.
So, Nima, I introduced you as the co-founder and the CEO of the Wound Company. How has the staffing shortage, specifically with nursing, impacted your company and just care across the country?
Yeah. So what we see nationwide is that there's a growing demand for wound care expertise, but a dwindling supply of folks who are actually certified and expert in wound care. Julie, who's been certified in wound care for 30 years and is our head of care delivery, is really an exception. When you look across the country, we find that the average age for a certified wound ostomy nurse is approaching 60, and that also exacerbates the issue of having more patients than ever before and less staff available. On top of that, after COVID, especially hospital working environments have not been very conducive to all of the career life balance that folks want. And so there's been even fewer in the hospital setting, and in the home care setting, it's an endangered species to find an individual who's actually certified in wound and ostomy care. And as you know, Lance, with the growing shift of care moving into the home, we have more and more patients at home who really need this wound and ostomy expertise, and we have fewer staff than ever before. For our company, which really specializes in wound and ostomy care and is aggregating a network of certified professionals who can really be aligned to patients and do their careers work continuously for just this patient population, I think we are shielded somewhat from the hospitals and home care environments where we're recruiting our professionals. But we also think carefully about how we can educate and develop talent and grow the labor supply for the country as a whole.
Do you guys see any issues? I know we've talked a little bit about the demographics and the age, but what about the disparities that might come into play when we're talking about, racial demographics or economic demographics? What are there any special inequalities that fall into those categories, or?
We see disparities economically, of course, and in terms of race as well as geography. So patients of lower income, patients in a rural area, and Black, Hispanic, and Indigenous patients are at higher risk of wound care issues and complications. The rate of amputation, as a statistic for you, for Black Americans for lower extremity wounds is 4 to 5 times that of white Americans. So there are significant racial disparities in care, and we think that's part of the issue that needs to be addressed systemically when looking at the wound care industry.
Yeah. Julie, I want to go back to you for a minute. Nima was talking about the average age of a wound care nurse, and I don't want to get into age here on anyone, but what do you think contributes to that?
I think that there's a lot of opportunities within the nursing profession in general that nurses may take a different path. They maybe want to go into delivering babies or working with babies. Wound care and ostomy care is highly demanding physically on your body. You're helping to move patients, lift patients, the odors and the smells that go along with it. You're generally, when you are working as a nurse in the acute care setting, you're not just assigned to a station. Like the wounded patients don't come to you, you're going to every station. So if you're at a campus that has 3 or 4 different buildings, you may be running up and down the floors, seeing all these different patients, and even getting on a shuttle to go to another campus to see patients later that day. It's just very physically demanding. So I think that, there may be just not enough opportunities for nurses to get their advanced certification for cost-wise. Maybe they've just finished their education and paying for a bachelor's degree, and now they have to pay more for the certification on top of that. So that may be some of the reasons why some of the younger nurses aren't going into it. And they're not educated, they're not getting a lot of education on wound care in their bachelor's degree. So some of these nurses may not even know that this is a specialty that they could go into until they're well into their careers and maybe have already selected a different path.
Okay. Do you mind me asking, was there something that drew you to the specialty?
Yes, seeing the patients become independent again. I was a home care nurse, and I love taking the ostomy patients. A lot of the nurses didn't want to do that. They had never changed a pouch or a bag on a patient. And there was nothing like the feeling of having a patient think that they could never live like this or go out into public ever again. And they are totally independent after the time that you've cared for them. They are going out to dinner, they're going to a movie, and same with the wound patients. When you have seen a wound the size of an egg or larger on a patient's body, and you've healed that wound up, there's just nothing like it. You really feel like you've contributed to their quality of life in a very impactful way.
Yeah, absolutely. Nima, I want to ask you the same question. You're the CEO, a co-founder of this all too important service that you're providing. What was the background, or what was really the motivation for going in this direction?
Yeah, my earliest childhood memory is of an uncle who was a bilateral amputee because of wounds that were mismanaged. And I remember the image of him being the only adult sitting on the floor on sheets, being quite traumatizing for me as a kid. And that kind of stuck with me. And I've unfortunately had other folks in my family who have diabetes and diabetic foot wounds that have also ended up with amputations, and folks with disabilities. And that motivated me to build prosthetic implants for others internationally. I spent some time in Guatemala building prosthetic implants, largely for indigenous communities who didn't have access to good wound care. And that really propelled me to go into healthcare innovation. It wasn't my first stop, but along the way, I was head of innovation for a global medical device company in the wound care space, now part of Abbott. And that's where I saw that this problem is actually getting significantly worse, and that the existing stakeholders are not really aligned to a solution that serves the patients, serves affordability, and serves the existing providers who are coping with this issue, whether it's in the home or another side of care. And so that led to the founding of the Wound Company, and a chance to bring my personal history and experiences together and work alongside visionaries like Julie, who've dedicated their careers similarly to this field.
That's wonderful. And I've always found usually the companies or the services that start with a personal connection usually are the ones that are going to provide the best service too. And I think that comes across quite well here with you guys. Now let's talk about the overutilization of services and fees for service incentives, because we all deal with insurances and these different things, and there's quite a frequent criticism in the healthcare space because of it. Do you see a path forward from here?
So maybe just to provide context on that for your audience, there has been a history of fraud, waste, and abuse in the wound care space, and unfortunately a history of seniors and some of our most vulnerable populations being taken advantage of because of perverse fee-for-service incentives that actually make wound care lucrative. Now, the problem is that many of the companies that specialized in wound care historically, they were economically benefiting from patients having more wounds and staying wounded, because in effect, it became an annuity. And there has been no enforcement of the actual outcomes or healing. And so while some of those companies do very good work to help patients, the transactional incentive structure has actually contributed to rampant overutilization. Some of the largest players in this space have been sued under the False Claims Act by the Department of Justice, and their fraud, waste, and abuse lawsuits are in the public domain. So we know that from the very top of the pyramid, there's issues of accountability, and that has only been worsened. So it used to be that with hyperbaric oxygen, we saw dramatic overutilization of hyperbaric oxygen. In recent years, that opportunity has shifted to various skin substitutes. The number of different skin substitutes available went from 2 to 90 in just a few years. And with that, there's a proliferation of folks ranging from physicians to podiatrists to nurse practitioners with very limited training working in private equity-led companies that are applying these skin substitutes very widely without providing the kind of continuous care and monitoring that is necessary to these patients. I mean, Julie and I, in our work, we see patients on hospice who are passing away from chronic obstructive pulmonary disorder, and there's a wound care vendor in there applying curative skin substitutes and charging Medicare thousands of dollars for applying that. So we see this daily, and we think that part of the issue in wound care that needs to be resolved is this issue of overutilization of these types of episodic procedures, because it erodes trust in the very establishment that we need to build trust between patients and between providers in order to move healing forward.
Right. Julie, I see you nodding your head. I want to go to you real quick. You've been in wound care since probably a graduate nurse. What are some of the things that you have seen that have improved since then, as far as, billing practices, access to these, specialties or services? And what do you see that still has a ways to go?
Well, I think overall, most practitioners want to do the best for their patients. I think that over the time that I've worked, we've gone from very few dressing change options to a multitude of advanced wound care options, which is good because we can individualize the patient plan of care for that particular wound. What I think we have a ways to go on is really overseeing the overutilization of very expensive products. I think that patients and practitioners, they think that the more money something costs, probably the better it's going to work, and not always is that the case. We heal patients over and over again with really just good basic wound care, nutrition, supporting the patient overall. And I think that's really where we need to go as from a payer perspective, is really getting the equipment, not necessarily the bandages that the patient's going to use, but the equipment that's going to support them in healing. Maybe it's specialty beds, maybe it's positioning aids, maybe it's bandages that they might need to use more often than what Medicare allows, and allowing us as practitioners to make that decision, where some insurance companies will only cover a compression bandage once a week for the leg. That patient might need it 2 or 3 times a week at the beginning. And I think where we really need to go is looking at that and saying, yes, that's okay, because that's going to save us money in the long run. It's going to keep the patient out of the emergency room. It's going to keep the patient out of the hospital. It's going to keep them out of a transitional care unit if we can really provide them what they need based on their symptoms rather than on a formulary that we say this is the norm.
If someone watching or listening to this, and let's say they're in that situation where maybe they need that, pressure sock 3 times a week, but they're saying you can only get 1 a week, is there a recourse for them to contest that or protest that, or
they can try, but by the time they can get through the system, it's probably too late. They can send into the insurance company and ask for them to reconsider that. The process for each different type of insurance company, whether it's Medicare or medical assistance or a private insurance company, is long and difficult for some of these patients, especially the seniors, to navigate that avenue. So it really should be practitioner, whether it's the nurse practitioner or someone like me that's a certified wound ostomy nurse, or the physician overseeing the wound care, to say, here's the symptoms, and this patient needs this treatment, but they need it a little bit more frequently than the norm. So it would be really difficult for, I think, a patient to actually get reconsidered for more frequent.
Right. Well, I just, when you were talking about that, it made, kind of resonated with us. We had a lady who, she's since passed, but she was in her 40s and she had ALS. So, very debilitating disease, very progressive. And she was in her early 40s. Her husband was a school teacher, and her health insurance company actually called us. And now, home care cannot bill health insurance or Medicare, at least not presently. We're hoping that changes in the future. And the case manager said, well, I realize you're probably really confused by this because, yes, insurance doesn't pay for it, Medicare doesn't pay for it, no matter who you are. But our board of directors actually took her case specifically, and we had a meeting about it, and we ruled that we'll let our health insurance pay for her home care. And we were asking her, well, what was unique about this? Well, it would be more economically advantageous for us than putting her in a facility. And she only needs help, 9 to 5 while her husband is at school during the school year. But my question was, couldn't you make that case and argument for almost every single person that's in a nursing home that doesn't require, clinical, intravenous therapies or anything like that, and have them in their home and have them cared for, and it would be more economically advantageous. So it just seemed kind of strange, that they picked this one person out of all these others. But, hopefully that will change. And, because, talking about the fraud and the overbilling, that's really not unique, right? Just to the wound care specialty. Would you guys agree with that?
I think that the wound care specialty is an area of particular concern. Unfortunately, I mean, this happens everywhere in healthcare. A few actors can even cause an entire category to be misrepresented. But in wound care, what we see is that outcomes are deteriorating despite skyrocketing expense. Last year, we amputated 158,000 limbs just due to diabetic foot wounds. That's over twice as many limbs as we amputated in the entire Civil War of the United States. And that number is a 75% increase over the last decade. So in the last decade, we have had an explosion of technologies for wound care, new skin substitutes. There have been advancements in negative pressure wound therapy, incisional wound vacs. So there has been a burst of technology, and there's been a large increase in the expenses going to wound care, yet the outcomes have gotten worse. And the American Diabetes Association's prediction is that in the next decade, we're going to see a similar 75% increase. That's untenable. And so I do think that wound care is one of the areas where we have the worst ratio of what we're getting for what we're paying. And recently, some data came out of England showing that after cancer and diabetes, the third biggest expense to the NHS system overseas is actually wound care. And we think that the problem in the US is of a similar magnitude and proportional to our population. And this is an area where we really need to sharpen our pencil compared to other spaces that have already gotten the attention and voice that they need.
Yeah, absolutely. Let me ask you both, how, we mentioned about how there's so few wound certified nurses out there. How do you go about increasing the number of certified wound and ostomy specialists? Is telehealth an answer? Like, if you guys were decisions makers for the day, what would you do to increase these specialties and certifications?
I think one key is really making sure everybody is practicing at the top of their license. So in partnership with home care providers, one thing that we do is we have a certified wound care expert virtually assigned to every patient that a home care or hospice provider is seeing. Our certified expert is designing the recommended plan of treatment, recommending specific supplies, and then is virtually available to work with the home care nurse assigned to that patient. So today we have some nurses in rural areas who have never seen a complex, let's say, stage 3 pressure injury. Maybe they don't have any experience working with a negative pressure wound therapy device. And one of our experts is able to support thousands of patients and providers. So that home health nurse is actually able to text and coordinate or email with our nurse, jump into a Zoom visit like the Zoom we're having here, Lance, and basically provide that nurse with less training and no certification in wound care with the tools and techniques that they need to deliver the highest quality wound care. When we do that, we increase our leverage with a limited labor supply to serve an order of magnitude more patients, and we allow for continuous monitoring and continuous assessment of those patients in a way that having a certified wound care nurse in a major urban area hospital who's on the receiving end of wounds that have deteriorated and are on the verge of amputation really doesn't serve anybody, neither that nurse looking to practice to the best degree that he or she was trained, nor the folks in the community who are not equipped to support these patients. So with technology, there's a lot that we can do. You mentioned an example of a patient with ALS. Through analytics, we can identify who needs a wound care expert assigned to them, who is at heightened risk for a pressure injury, for example, because of a neurodegenerative condition. And then we can also utilize analytics to adjust the plan of care based on how wounds are progressing. So if there is a wound that has stalled, that we can bring more attention to that wound, or if there's a heightened risk of infection for whatever factors, and that itself helps us to be more efficient with that limited supply. Julie is also working on some strategies with lower levels of certification and how to train a new generation of these wound care experts, who can learn under the wings of our, more tenured care professionals that she can describe.
Yeah, there's different levels of certification, and we can start with an RN that has an interest in wound care, put them through a training called a Wound Treatment Associate, and get them certified in that, which is a stepping stone to the the actual certification for wound and ostomy care. And this will help the nurse kind of graduate into that position where we can hire that nurse as possibly a field staff that's helping assist, the patient getting ready for their wound care, taking the dressing off, measuring the wound, and then coordinating with our actual certified wound ostomy nurse through telehealth to come up with a plan of treatment. And then as that nurse with the wound treatment associate certification moves up and has more experience, then they can actually go through the training to be a fully certified wound and ostomy nurse.
That's wonderful. That's wonderful. Let me ask you both really quick. Let's say a wife or a parent or somebody that's a lay person, no healthcare background, is watching or listening to this, and they have a loved one who has a wound, and they've just been handling it and managing it themselves. Does the wound company support families, or is it only through like a healthcare provider of some nature?
Right now, we work primarily through structured partnerships with health insurance providers that specialize in Medicare Advantage or Medicaid. We also work with home care and hospice providers, and then other types of health systems and providers to get to the patients that need our services. Within those, we have worked very closely with family. Julie can give a recent example where the spouse of the patient was involved, and we were actually able to do one in-person assessment and then 7 virtual assessments and help this spouse be a supportive caretaker in the capacity that she wanted. And, we have the mechanisms to broaden our services within the next 12 to 18 months to be able to accommodate, individuals and their families who may want to source our services directly. Julie, do you want to give that example? I think it would be.
Yeah, we had a patient that was completely paralyzed. His wife was his caregiver 24/7. He had to be fed and turned and moved, and he developed a severe pressure injury, which he had to be hospitalized. It was debrided, and when he came out, our company did one in-person visit and assessed this large wound down. A stage 4 pressure injury is essentially down to the muscle or bone in the area. We supported him with one in-person visit and then just followed him virtually and through telehealth visits with his home care nurse. And we've taken that wound that would typically take 1 to 2 years without any skin substitutes, any more debridements. We had to use a machine that would provide pressure, suction on the wound. It's called negative pressure wound therapy. We did that for about 6 weeks, but rather than 1 to 2 years, we've almost got that wound down to the size of a nickel, and it was on the surface the size of an egg, underneath maybe the size of a baseball. Wow. Underneath the skin. So we're really able to really support that patient, and it's not that it was always progressively improving. There were weeks where there was a change in the wound presentation. There was more odor, something didn't look right. Our staff was able to get on it, make an immediate change, and then the next week we again saw progressive improvement. So it's so immediate, and people don't have to wait for an appointment 4 to 6 weeks down the road, or to get onto a gurney, into an ambulance, or into a wheelchair, into a van, into a clinic where they have to get in a lift and get on a bed. This is all done within the comfort of their own home.
Right. That's wonderful. And people who have not experienced those pressure sores and that breakdown, I mean, that what you just said is pretty miraculous. To go from that to what the end result was is tremendous, and just a testimony to the incredible work you guys are doing. I think, I mentioned earlier, usually having that personal connection, that background, that kind of skin in the game, so to speak, really makes a difference, I think, in how companies are operating, what their values are. But oftentimes it's not the case. It's a business model first, bottom line first. That patient doctor, that patient healthcare relationship seems to really be broken or non-existent altogether. And the families are the ones impacted the most by this. How do you guys recommend our healthcare system in general restores those more personalized, I'm not just a number to you relationships?
I think it's important to really align patients who need specialized services with folks that are also able to deliver those specialized services. And that's easier said than done. And I think home care is a really important frontier, because a qualified home care provider, when they assume responsibility for the patient, they're assuming the responsibility for being the general contractor to that patient. And by virtue of that responsibility, they have to be capable of addressing a very wide set of needs. And the individual home health nurses who are qualified need to be generalists, out of necessity, right? And so it's not a function of wanting to be transactional or cut the patient short, that they can't be expert in everything. That's actually not realistic. They need to be the general contractor and the facilitator. But then there's the need to bring in specialized experts where they are available to support patients. So when a home care provider is able to bring in a wound care expert and bring that wound care expert in as a continuously engaged project manager that's effectively there to make sure the patient's getting the right wound care with the right supplies and someone's got eyes on the wound, that is what's going to help elevate the patient's care and ensure that, the patient is in an environment where they're really getting the right care at the right time from the right provider. So it takes cooperation. It's not just one business, it's really businesses coming together to deliver that high quality care. And one company needs to be the general contractor. And that's where we see home care and hospice providers playing a really important role. They're going to be managing that patient holistically, and we're going to be the experts that respect their place, but are coming in to really focus on the wound and build that longitudinal relationship with the patient around their wound care. In our health plan work, that becomes the relationship with the primary care provider. We are not going to disintermediate the patient's primary care provider. So we work really closely with the primary care provider who, some of the PCPs right now have panel sizes between 3,000 to 4,000 patients. They don't have time to talk about diet, medication, wound healing best practices. They need a wound care expert on their right hand that they can trust, who's going to build that relationship. And that way the patient understands that, they are not really just a cell in a spreadsheet, but they are, receiving this integrated holistic care, and everyone is doing the very best they can to support them.
That's wonderful. Julie, did you have anything you want to add?
Yeah, I think with our model of care, we're a high touch, proactive care delivery team. We're not waiting for the patient to contact us. We're not waiting for the nurse caring for the patient to contact us. We're proactively reaching out. We will make new recommendations in the following week. That virtual care nurse assigned to that virtual wound care nurse assigned to that patient or nurse is going to reach out and say, did you get the supplies? Did you get the right supplies? How's it going? Is the patient having any reactions to that? How are they eating? We're really looking at everything proactively. We're not waiting for the patient to come back to us. At a wound clinic, they may go back once a month or every 6 weeks, and that's when they're being seen. That wound clinic doesn't know what's going on unless the patient reaches out to them. We're different. We're proactively, systematically reaching out to these patients based on their acuity and putting them in programs where we know that they're being followed closely and they're not going to slip through the cracks.
That's wonderful. I want to leave you guys with one last question. If we talk to you in the next 3 to 5 years, what would you say is different about the wound company then than where we're at now?
Good question. Our vision is that in 10 years, everybody with a wound is going to have a wound care expert from our team assigned to managing their care, ensuring that they're getting the right wound care in the right moment at the right time, and that the wound care they're receiving is the wound care that they need, not the wound care that's necessarily profitable for a particular actor. And in 3 to 5 years, I think we hope to be approaching half of all of the wound patients in the United States. What that's going to require is partnerships with more of the health insurance plans that are covering these services and looking to realize the cost savings and improve quality. It also is going to require closer partnerships with home care. A lot of the patients that we work with are comorbid. They have a number of different chronic conditions. Many of them are eligible for home care. Many of them are currently in the care of home care providers, some receiving 3 times a week, 5 times a week skilled nursing visits. And within those patient populations, what we're seeing is that because of the staffing issues that home care providers are facing, because of the attrition, the lack of credentialing and experience in the folks that they have to recruit to provide that baseline care, that many of these patients are not currently healing. They don't have preventative strategies in place, and they are developing new wounds in addition to the wounds that they started with. So the specific goal that we've outlined for ourselves is that before we reach 100% of patients who are covered by our services through health plans, we want to make sure that we have formulated partnerships with home care providers so that we can elevate their ability to deliver higher quality wound care in place, because that is a lost opportunity when there is somebody who is clinically trained visiting that patient's home multiple times per week, and the patient is not able to get the care that they need. And that provider, that clinician, is also not able to practice at the top of their license. If they're in an environment where they don't feel like they are trained to do their best work, that's contributing to that attrition. And so to elevate their ability to deliver care is really what I would like to see in the next 3 to 5 years. So folks who are getting that level of intensive home care are really getting the best wound care. That's something that we can imminently control right now in partnership with other home care providers.
And I think that is crucially important. Like I said, from a personal story, and with the countless families that we come into contact with our company, how do you prefer providers reach out to the wound company? I know the website's going to be here up on the screen. It's thewound.co. Do you prefer they go through the website? Is there a phone number or an email that you would like them to utilize?
The website's just fine. We welcome any questions and any outreach from folks through the website, and that's probably the easiest way to get a hold of our team.
Wonderful. And it'll be in the show notes as well and up on our website. I want to thank you both for the work you're doing. It's so crucial and important. And, you know, if we can be of any help or service in the future, we look forward to doing so. And we'll have to have you guys back on.
Great.
Thank you.
Thanks for having us.
Thank you both so much.
To this issue.
You're welcome. Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Mr. Nima Ahmadi and Julie Roskamp for joining us today to discuss the Wound Company. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.